Hello everyone, my name is Dr. Brian Campbell. I want to take some time to talk to you briefly today about the topic of depression. Depression is very common in human beings, and it's something that you may have even experienced yourself. But also as a counselor, you're going to be experiencing or having clients who are depressed on a very frequent basis. 70% of all cases have to do with anxiety or depression. So I want to turn to that topic today and see if we can get an understanding of it from a Christian cognitive behavioral perspective, actually an integrated perspective, because depression, of course, can be a biological event, and of course it does run in families, and so we need to talk about that. So let's first of all talk about different forms of depression. One of the diagnostic categories is adjustment disorder with depressed mood. That's depression that occurs when an event occurs in life, but the reaction to that event remains long after you would anticipate the event to a reaction such as depression. So that's a life event followed by depression, which goes on beyond when you would expect it. Then there's a major depression, of course, and major depression can occur with and without psychotic features. Sometimes people actually have delusions, etc., in accompanying their depression. It can be very, very severe, major depression. There are 4 cardinal symptoms for that. The first is anergia, which is lack of energy. The second is anhedonia, which is lack of pleasure. So things that are normally pleasurable just aren't that pleasurable. By the way, the anergia, you just feel tired, energyless, etc. Then we have eating problems, eating too much or eating too little, gaining weight or losing weight, and sleeping problems, sleeping too much or sleeping too little. So those are the 4 cardinal symptoms. Also, you have feelings of hopelessness or helplessness. So when you see these symptoms, you start to think of major depression. Dysthymic disorder is another form of depression. Now, dysthymic disorder, dysthymia, has to do with a type of depression that's more chronic. It's not quite as deep as major depression, but it lasts a lot longer. So it's up to a year or 2 years, depending on whether you're a child or an adult. So and that form of depression has as a characteristic of it low self-esteem, whereas major depression does not have that as a characteristic. Dysthymia can have that as a characteristic, and it sort of seems to drive the length and of the depression. Then we can have bipolar disorder with depression, and depression and bipolar disorder can be very severe as well, and it can be very long-lasting. Basically, the diagnosis of bipolar disorder, you only really require 1 manic episode, and then that can be followed by sort of a lifetime of depression. So those are the major categories of depression that we will be looking at, or that we would consider as counselors. Now let's talk about how we would go about looking for information regarding depression. Well, we have a client history that we take, and we have clients fill this out. And in there, we're looking at sometimes biological factors that might be related to depression. There's a host of biological factors that physical problems, etc., disorders that can have as side effects depression. So you have to be careful. You see a certain person with depression, doesn't mean that it's necessarily depression occurring from psychological events, but more from physical or biological events. For example, hypothyroidism, that's low thyroid, can present as depression, strokes, encephalitis, heart disease. They can all have symptoms that look like depression that may be more related to biology than they are to, quote, psychology or psychological events. So we need to look for those, and we need to be aware of those. And in the paper I'm giving you as handouts will include a list of those factors which may have secondary side effects of depression with them. We also need to look at medications clients might be taking, and that's part of the client intake. There's a whole list of medications I'll be giving you too that may have as side effects depression. So the depression that you're seeing may not be something based on cognitive factors, but maybe based on side effects of medication. So we need to look at that too. So we need to consider these biological factors, and of course we need to also look at family factors. Depression tends to run in families. It's not necessarily one-to-one relationship, but very often if there's major depression in the family, that also might relate to a biological or an endogenous type depression versus a depression that's more psychological in nature. So the treatment of depression, we use may require medication, and you'll have to refer the client to a psychiatrist or a family physician for medication if the depression seems to be particularly severe. And you're going to have to use clinical judgment, and to begin with that's going to be hard, but you are going to have to determine when you feel that you should refer for medical treatment. One of the things I do after seeing someone and I start to see symptoms of depression, by the way, that's on the client history as well. We ask for current symptoms, what they're feeling, if they're feeling hopeless and helpless, etc. But then we start tuning into the fact that we might be dealing with depression. So we take stock of those things. We also might be looking for suicidal ideation. That's a tough one. Suicidal ideation may be present in individuals who are depressed. It may not, but also one of the most revealing things, or one of the things that we need to really pick up on, is whether there are any plans for suicide or any previous attempts of suicide, and that you can ask the client, and also it should be in the client history as well. And especially in those instances, you want to err on the cautious side and refer them to, for example, a psychiatrist for a second opinion if you feel that the person may be suicidal. And sometimes you have to actually call the police or call the hospital and have them immediately go into the hospital if they are seriously suicidal. So, the types of medications I give you in the handouts too, a list of psychotropic medications that are used for depression. There's about 3 classes. The old class had to do with tricyclic antidepressants. Then more recently we had specific serotonin reuptake inhibitors, or SSRIs. And then the most recent we have SSNRIs, which are specific serotonin and norepinephrine reuptake inhibitors. The new antidepressants are really neat because they actually treat not only depression symptoms, but they also treat anxiety. So very often a psychiatrist, especially if there's anxiety along with depression, will prescribe a depression instead of giving an anti-anxiety medication, which can become addictive. They'll give an antidepressant, which usually can work very well in terms of anxiety and depression. So that's a good thing to know. There are side effects of each of these medications, and I list the medications that are commonly used to treat depression, but there are side effects of those as well. So the more you can learn about these medications, the better. And over time you'll start to acquire information on these and read about them and study them. And I have links to all the different medications, so you can go and read those and check those out. And so there are also any other types of medications the client might be taking that are not psychotropic medication, may have side effects of depression. So there's a whole list of those as well. Okay, now the cognitive behavioral, or Christian cognitive behavioral therapy of depression, what we're doing there is we're going to actually use our clinical interview and our client history here to look for information regarding depressogenic thinking, family history of depression, but we're also starting now to look at, for example, family members who have been depressed will pass on environmentally through what they say and through their own perceptions the whole depressogenic type thinking style. They'll be looking at negative things, they'll be very negative. And you can look at that through the history and see what the parents are like in terms of their own depression, whether they've been treated for depression before. And they then will sometimes pass on these irrational beliefs or thought patterns that get inculcated into the individual's mind, and they basically learn a pattern of thinking. Very often depression is characterized by what we call dichotomous thinking, black or white, all or none, and usually it's the black. Dichotomous thinking, there's no gray, it's just black. And individuals with depression are often feeling totally hopeless and helpless, and so we need to look at what those scripts are that they sort of have learned, and the cognitions that they have. Now, one of the things I do, I have a handout here on discover the lies or discover the depressogenic thinking. And I have statements there that clients can look at and discover, and check off basically the thought patterns that they might be having, and that can be a window into the irrational beliefs or negative thinking that they're having, that you can then go back and target those things and start to challenge those and to question those and bring them into the light of our faith, into the light of creation, basically salvation, into the light of eternity and heaven, putting things in perspective, helping them look at their problems from a different perspective is very important. And of course, as Christians, we always have hope. We have God, and God is the God of hope. All are among the living have hope, it says in the Bible. So bringing our faith into that can be done, subtly. It can be done immediately. But very often we're working with the client to try to bring them out of that depression and that depressogenic thinking by having them look at the truth, which is in the Bible, and the truth. Sometimes I have people focus on the positive things in their lives. For example, have them get up in the morning, make a list of all the things that are bothering them, and then praise God for them, and also list all the positive things that are in their life. So I want to develop some attitude of prayer and of thanksgiving, and sort of look at what we have versus what we don't have. Sometimes perspective, well, how does this compare to being nailed on the cross, And sometimes I use that perspective taking also to help people break up their depressogenic thinking. So it's important to challenge the thoughts, to replace them, to question them, subtly sometimes directly, sometimes having clients memorize scriptures that directly counter irrational beliefs or negative thinking. Sometimes even having people do things. The behavioral part of cognitive behavioral therapy, we actually have people get up, get out, and go and do things. Very often they're completely switched off, and they think they can't do anything, there's no hope, they can't. And so by getting them up and out, my own mom got depressed when my father died, and she called me and asked what to do, and I said, Mom, get up, get out of that house and go and do something. So I have a list of things also that pleasurable activities that I have people sort of engaging, going to a movie, or going to a favorite play, or listening to music. Music can be very important for defeating negative thinking. So what we're doing then over time is identifying where those irrational beliefs, those negative thoughts are, where they came from, helping people to become aware of those, and then start to identify scriptures and perspective taking and cognitive refutations and ways and techniques to break up those irrational beliefs, to bring them to the truth, and the truth sets you free. We know that the fruits of the Spirit are joy, peace, etc. And that's what we want to bring people to a knowledge of Christ, and to a knowledge of salvation, and to knowledge of eternity, and even look at their problems from the backdrop of eternity. So it's a sort of an integrative process that goes on over a fairly long period of time. Sometimes can involve direct scriptures, prayer certainly, and targeting irrational beliefs and encountering those with the scriptures and with the truth. So that's how we go about dealing with depression from a Christian cognitive behavioral perspective, and also an integrated one. Remember, we have to understand and keep track of what's going on with biology too. When biology meets psychology, biology wins. God bless everyone.